that one. So what we can see, how ultrasound can help, like situation like this young man who was having a big swelled leg over here, loosely hanging skin, if you palpate it, you find lot of fluid collection, lot of fluid fluctuation, shifting, dullness over here. So what they thought it is a case of something degeneration, but this is the ultrasound which shows you highly echogenic foci which are seen freely floating in this, and these are the fat globules. This is a total destruction of the muscles, and this is cystic collection in the muscles. But they wanted to know about the vessel, and vessels were absolutely fine, and this was again a case of chronic lymphangitis. Chronic lymphangitis resulting into complete degeneration of the muscles involving whole of the leg, starting from the thigh, knee. Another leg was absolutely fine. Start whole of the leg, and you can see the fat globules freely floating, the cystic degeneration, and these are the vessels, and totally destroyed muscle texture in the case of chronic lymphangitis. This is a very interesting case. A son of my colleague, Dr. Kuli, who was swelling over the elbow. Bones were absolutely fine. They thought it's some tumor, but the bones was, then they thought it's some muscle tumor over here. But when I did ultrasound, I found a cyst over here, you can see. Then we found a highly echogenic focus which is seen fixed with the inner wall of the cyst. There are two foci, and this is a typical picture of cystic circle cyst. If you see this picture anywhere in the body, you can immediately, it is spot diagnosis. I have got the largest series of cystic circle cyst in eye and orbit in the world. I have got the largest cases of this in orbit, but we are getting lot of atypical cases now. I've got cystic circle in breast, and again on my recommendation, I asked them to go for the albendazole therapy. They didn't believe. They went for an MRI. MRI said this may be a tumor, this may be on just my insistence, I requested my doctor friend, don't do anything, give just albendazole for 6 weeks, and this is the story. The cyst resolved, the scolex that died, and there's only localized thickening of the muscle is seen over here after 6 weeks of albendazole therapy. So what do I mean to say? It is not evaluating and diagnosing, but it is also very good in evaluating and seeing the response. So this is again you can see a cystic circle cyst in the forearm muscle. This is the cyst. This is the highly echogenic nidus, which is the scolex seen fixed with the inner wall of the cyst. If you see this picture anywhere, immediately you think this is a cystic circle cyst, because this is the spot diagnosis what we are getting. At times we are seeing the tumors like this on the cheek of this child. We can see here when we did, they thought it may be something vascular tumor, that we found there's a big tumor mass which is seen sitting and involving the masseter muscle. Can you see here? This is the mandible, ramus of the mandible. This part of the mandible is also eroded, and again a child who was having a lump here in the groin, in the loin area. You can see they thought it is some abscess, but when I did ultrasound, I found this is involving here and going anteriorly and seeing and invading the iliac fossa. Unfortunately, both have turned out to be the rhabdomyosarcoma. So these are the cheek masses, rhabdomyosarcoma of cheek. Unfortunately, this child died after 1.5 years because there is no treatment for this. This is still under follow-up. So this is the case where we can see the muscle tumors invading the bones, in the case of rhabdomyosarcoma. Like situation like this, a big tumor which is seen here involving the gastrocnemius muscle with liquefaction, but this is the tumor nidus. Somebody thought it to be tuberculosis, they tried to drain us, but on biopsy again this turned out to be rhabdomyosarcoma. But at times we can get a swelling over here, but the bones are absolutely fine, and we get well encapsulated mass. This is well encapsulated mass with homogeneous texture, with homogeneous echos, and this is the capsule. This is nothing, this is a benign tumor, and this was a fibroma of the muscle. Then again you can see a malignant tumor over here with the skin discoloration over here in the bicep. This is the humeral shaft, this is the normal muscle, and suddenly there is a rupture of the capsule, and this is a normal texture loss, capsule broken, and multiple hypothelial, again a case of rhabdomyosarcoma. Not only that, we can see the metastatic deposit. This is a case of CA rectum. Known case of a CA rectum, patient had sudden pain in headache, Then he was having pain and diminished vision in the orbit, eye, and then painful joint and the muscles. And these are the multiple metastatic deposits in the triceps case, muscles of the forearm, in the arm, in a case of known case of the rectum. And also he was having deposits in the retrobulbar space of the orbit, and also having the deposits over the brain. So what I mean to say, you can see swelling of the muscle, irregular masses. In a case, these are the cases where we can see ultrasound can help you, and this is the where we can see the flow in the muscle on power Doppler tumor. Well-defined tumor we can see here. This is again a fibroma, well encapsulated, capsule not broken, and this is the flow which is seen here in the muscle. Everybody knows the diagnosis. There is no point to do the ultrasound because we know this is a big tumor involving the thigh. We can do a biopsy, immediately come out to diagnosis. This is a bone, absolutely fine. This is the soft tissue mass. Then why they requested for ultrasound? Because they wanted to know about the status of the vessels. Superficial femoral artery, common femoral, and this is the vessel. And this is a big tumor involving all the compartment of the thigh. Fortunately, the vessel is intact. This is the superficial femoral artery, because for surgical and for this they wanted to know what is the status of this vessel, and this vessel is absolutely fine, though it is compressed but not eaten up by the tumor. At times we can get the tumor vascular masses, like this is trauma. In a firearm injury, we can get the tumor over here, but not very pulsatile. This is the ulnar artery, and this is the pseudoaneurysm of the ulnar artery, which presented as a tumor. At times, again in trauma, we can get the fistula formation between two vessels. This is the artery, superficial femoral artery, and this is the popliteal vein, and this is the communicating fistula. And when you put a color, you can see lot of fluid coming up, blood going on, lot of aliasing taking place. So this is a communication site, and this is a traumatic AV fistula between two. Then coming to the tendons, ultrasound is very helpful in evaluating the tendons, and it is really informative and gold standard for evaluating the rotator cuff. What we can see is subscapularis tendon, supraspinatus tendon, infraspinatus tendon. Then this is not the part of the tendon biceps, but this is the ideal structure to be seen for evaluation. But this is the landmark, sonographic landmark, to have a roadmap on which you have to do your study. This is the what are the conditions, what are the pathology, like non-visualization of the cuff, local absence of the non-visualization of the cuff, discontinuity, focal abnormality, echogenesis. This is the biceps tendon. Here you can see the tendon running in the biceptal groove. A small amount of the fluid is also seen in the biceps tendon in a case of biceps tendonitis. Then you can see anatomically how beautiful it is seen, like in the bicipital groove, the head of the tendon is seen here. This is the subscapularis tendon or anterior cuff, and this is the deltoid muscle, and this is a longitudinal view of the biceps tendon. You can see this is the bicipital groove, and this is known as a bullseye sign, again, or target sign, where we can see the biceps tendon. Then coming to that, in the pathological condition, we can see the disruption of the fibers in the tendon, biceps tendon, with swelling, and we can see the fluid collection in the tendon. Sheath is again case of partial rupture of the tendon with biceps tendonitis, you can see. Then we can see again discontinuity over here, and we can see the fluid collection in a case of biceps tendonitis. Chronic tendonitis, acute tendonitis does not show you the vascular flow, or it is due to the proliferation of the synovium and the vessel proliferation. In long-standing chronic synovitis, we get the flow. We can get here in a chronic synovitis of biceps, we can see swelled up tendon,